You know, you are this world-class coronary and valve surgeon, but you do have this reputation of operating on very old patients, and you have established here this ultra-elderly program for heart patients. Tell us about that.
Well, this is something that, of all the different programs at the Perelman Heart Institute, I think that it's one of the programs that we're most proud of, and it's certainly one of the programs that's closest to my heart. It really started back in the 80s when Dr. Isom, who's our chairman, and I found that we were starting to be referred patients that were in their 80s. Prior to that, as you know, Holly, in the 60s and 70s when heart surgery became popular, most of the patients were in their 50s and 60s, and a 70-year-old was an elderly patient. In the 80s, though, we started being referred patients that were 80 years old, and we didn't quite know what to do with them at first, but then we started operating.
As
and
clinical
they did well.
cardiologists, we like to prevent this disease and try to keep patients away from you, and they are presenting sometimes older and needing the surgery.
Absolutely, and you know, patients over 80 now are the most rapidly growing segment of our population, and so more of these patients are going to be coming to surgery. But
clearly, you know, as I do, there's chronologic age and there's physiologic age. What is your patient selection process? What is your criteria for operating on an ultra elderly?
Well, you know, that's a real good question, and we have a variety of different criteria. You know, certainly we don't just look at chronological age. We look at patients physiologically. All of cardiologists have all had 90-year-old patients that look like they're 70-year-old. There are 70-year-olds that look like they're 100, and so how the patient is doing clinically is very important. For example, one of the criteria that we like to use is that we want the patients in this age group generally to pass what we call the walking and talking test. They have to be able to walk to get through the postoperative period. And patients that can't communicate well with their caregivers often get depressed and don't do very well. So if they've had a stroke and can't communicate, they're usually a bad candidate for surgery. Physiologically, the issues that we look at are neurological function and renal function. If we think a patient may go into renal failure after heart surgery and need dialysis, then that usually rules them out.
It's just not about getting them through the operating room. It's about what they are like later. And
absolutely, it's critical that the patients do well long term. The two other criteria that are important to us are we want the patient to have some kind of family advocate. It could be a granddaughter, a child that will help get the patients through the postoperative period. And I know you and I have talked about this before. The most important thing is the patient has to be well motivated. The patient really wants to have the surgery. It's one of part of our protocol is never to talk a patient over the age of 80 into surgery. They've outlived their normal life expectancy already. We really want them to convince us that they want the surgery. And particularly if they have an idea or a reason why they want to go through the surgery, then that's an important criterion.
So you've really established a very collaborative approach with not the clinical cardiologists, the surgeons, the anesthesiologists, and I know you've done some seminal work with bypass surgery trying to prevent stroke. Tell us about that.
Well, certainly if you operate on a patient and they have a stroke postoperatively, which is one of the worst complications that we worry about.
Not a real success.
Not a success. In fact, it may be a fate worse than death.
Of course.
And so we've done some work. We've had 2 NIH-sponsored trials where we looked at ways that we could reduce neurological injury after heart surgery. The national incidence is probably 2 or 3%, but as patients get older, that risk goes up. And we found that there were some things that we could do in the operation to make it safer. And we've instituted some of those programs as part of our overall ultra-elderly program, and have had great success in reducing the rate of neurological injury with the surgery. And so worries about neurological injury are not a contraindication for surgery. Patients should still consider this, and the referring cardiologist should say they should not say that a patient is 90, too high stroke risk, shouldn't come in for surgery.
So patient pre-selection, very important. But,
Very important.
you know, you mentioned something, a patient who wants to have this surgery. And I know when you talk about these patients, you have a lot of admiration for
Absolutely.
them. Tell me about one of your patients.
Okay. As I mentioned in the beginning, these patients are close to my heart, and part of the reason for that is I admire them. I think they're brave to undergo the rigors of a hospitalization. Many of these patients have been at home. These patients, it's traumatic to have major open heart surgery or a long potential hospitalization. And so I do admire them, and there's been many patients over the years that I could tell you about, but the one that stands out in my mind, we operated on about 10 years ago. And he was a 92-year-old patient that came to my office after having been turned down for heart surgery. He had angina, chest pain, couldn't walk across the room without getting chest pain.
And he found you.
He had seen several other doctors that felt his operative risk was too high, and he had had 5 or 6 heart attacks. His ejection fraction, which is a measure of heart function, was 20%. He was a high-risk case, and I felt that his operative risk was 50%. And so I said to him, he lived alone, came to my office alone. I said, why would you want to undergo an operation that would have a 50% risk? This is quite high-risk surgery, and most patients wouldn't want to take that risk at 92. And I remember he looked at me and he said, because of the Yankees. He said, I've been a Yankee fan all my life. I saw the old Yankee Stadium being built. I saw Babe Ruth play in his first game. I saw DiMaggio, Mantle, Maris, all of the great Yankee players. And this was in 1998, in the spring of 1998. He said, I think this team, the 1998 team, is the greatest Yankee team ever. Better than the 50s teams or the teams in the 60s. And he said, I would like to see them win another World Series. And after I heard this story, I said, sign him up. And
how'd he do?
He did surprisingly. He surprised all of us because he came in.
It's always great to have a motivated patient.
Absolutely.
Say what you will.
He had
that
a son that was very devoted to him. He was actually out of the hospital in about half the time that I thought he would. His heart function got better when we reestablished the blood supply with the bypass operation. He went home. He did well. That year, he watched the Yankees win another World Series. He met George Steinbrenner. There were several articles in the paper about him. He was on the Letterman show. He became a little bit of a 92-year-old celebrity in the New York area. He did well watched the Yankees win several World Series, and about 4 years later passed away from an infection in his gallbladder.
Not even from his heart.
No.
That's a very inspiring story. And tell us, though, is mortality with these patients, is it greater, or how much greater is it?
Well, that's a particularly important question. Taking all of, in the last 5 years, we've done over 500 patients in this age grade, and their overall mortality is 3.5%. And it's just about the same every year. If the patients are over 90, the mortality goes up. It's around 6 to 7%. But if the patients are operated on electively, and this is the argument for elective surgery in these patients, the mortality is still around 3.5%. So even though they're 90 years old, it can be a relatively safe operation. And I give a lot of credit to getting these patients through to our nursing service, which is outstanding, our rehabilitation doctors. They are in the hospital for a longer period of time, but we have a great team of people at the Perelman Heart Institute that can put this together, and I'm very proud of our overall program.